We're successful.
Okay.
Is it ever?
No.
It's working.
Sorry guys, I'm pretty savage today, so I'm gonna try to tone it down.
Okay, I'm just gonna
No
quickly
guarantees.
review. I don't know
No
how much
disrespect,
in
of course.
depth they go into concepts in first semester. Do they spend a lot of time on the actual concept? I'm not gonna spend a lot of time because you should have had it. But what we're talking about is excretion of waste products, and that's by Giddens, which is your concept book. And when we're talking about the GI system, which is what we're talking about today, we're talking about bowel elimination. Passage of stool through the intestinal tract and dispelling the stool by means of intestinal smooth muscle contraction. Excretion of waste products, and that, of course, when we're talking about elimination, does include urine from fluids, but we're not talking really about them today. But remember, skin, kidneys, lungs, and intestines. I forgot that popped out. Scope and categories, intestinal effect, we will talk about control, incontinence, retention. Those are the discomfort. Those are the big things we talk about, and we will talk about when we talk about elimination today. So those are your major categories about it: control, retention, and discomfort. And continence is purposeful control. That's an expected function. So bladder or bowel. Incontinence is loss of control. So why do people have a loss of control? Undeveloped elimination mechanism. So what would be, when would that be? Undeveloped elimination mechanism.
Babies.
Babies, toddlers. They haven't, their sphincters are not developed enough and they don't have that control yet.
Older
When would
folks.
we see malfunctions
Older
in
folks.
elimination?
If you're older and you've lost
Maybe if you're
According
older
to Dr.
and
Chambers.
you've lost your muscle tone. What about, trauma, trauma, injury,
after you've had a baby.
certain
Yep.
disease, anything that impacts the neuromuscular system. And then alterations in cognition. So what would that be?
Dementia,
Remember, like especially with the dementia, I told you about how my neighbor fell down in the shower and he couldn't remember how to get up.
Huh.
He didn't know how to, I mean, he was capable as far as his muscles and bones, but he couldn't remember how. So they had to have the people get him up. Okay, retention. Retention, keeping within the body materials that normally or should be excreted. Now, we have purposeful retention, right? And that's okay, because that's considered control and competence. Retention is not usually associated with obstructions, which we will talk about over here. Inflammation, we will talk about a type of inflammation, or ineffective neuromuscular activation within the GI tract. So normally you would see more frequent stools or diarrhea with those things. But retention, if untreated, can result in significant discomfort, and actually can have serious consequences. And we'll talk all the way down to back to septic shock. Okay, elimination should be free of discomfort. Actually, it's often associated with relief of discomfort. But if people are having discomfort, they may have hard stool, they may have some inflammatory process going on, they may have injury to the anus, they may have hemorrhoids, infection, or if they have been going a lot, then they could have just irritation in their intestines. So those are reasons to have discomfort. Children have something, I'll show you a picture of it in a minute, and there's a picture of it in the book, but they can have a bowel, a telescoping bowel where it kind of comes back into itself, and that results in obstruction, abdominal pain, and also retention of stool. So what are the risk factors? Anything we said that can have a neurological impact, cognitive impairment, altered mobility, and you will have a unit on mobility. So why does mobility impact it?
Circulation.
I didn't hear that. I mean, I heard.
You can't move, you can't take yourself to the bathroom, so you're gonna have.
Right, so then you don't have good access.
Around.
Yeah. And also with immobility, you're probably not gonna drink as much, and that kind of, so that all helps. But the neurological impairment, so that would be like maybe, would a stroke be a good example of that?
Mm-hmm.
Or a spinal cord injury?
Mm-hmm.
An immunological impairment. And I actually, I can't name that for you, but that can be infection or just congenital defects. So the congenital defects go back to the other defects of the spinal cord, the brain, and any colon or rectal defects. Those particular things don't matter age, gender, or race, so they're not specific to anybody like some other diseases that you learn. Highest risk, cognitive impairment, multiple medications. So what medications would do that?
Oh, like opioids, don't they?
Yeah, opioids. Mm-hmm. What they do is, do you know how that happens?
Mm-hmm.
It decreases peristalsis. Mm-hmm. And therefore, that's one issue. And then if it slows down, more water is, fluid is pulled out, so then the stool becomes harder. But opioids are not the only medications. There are medications that can cause constipation or slowing of the bowels. So that's just things you need to read and know when your patients are on them. Excessive amounts of, we're talking about incontinence. Okay, wrong. I went backwards. Excessive amounts of caffeine, and yes, medications, but not it's the other drugs. We went backwards. Lots of caffeine can be a problem, and we never think about economic things, and some people don't have access to toilets, or not quickly. So there's people that have to go somewhere else to use a toilet. And immobility. Bowel incontinence occurs in about 15 million Americans, which is a lot, 8%. Risk factors for retention. Okay, lack of adequate fluids, fiber, or exercise, which also puts you into immobility a lot, and not just, but, and medications to dry out your system. So some of those narcotics and opioids, diuretics, antidepressants, and anxiolytics, and pregnancy. So what about pregnancy? You've studied that. Why is it an issue?
You have more pressure on valves.
Yep, and it's not priority body function. And you have more circulating volume, so you're taking more fluid out. Okay, concept review, elimination, and back and forth we go. Fluid and electrolytes, mobility, cognition, and nutrition, and actually acid base, which isn't on the concept, but it is. Things we're going to talk about today: intestinal obstruction, Crohn's disease. Now, some of these are inflammatory, but I got sit tenants.
It's right here.
It's here.
Yeah. Does anybody need it?
And did Jennifer pass one out?
Props.
Maybe you didn't, it's just Halloween.
Now I have two, one for each room. She slipped in here, she did it. Okay, I'm not. Well, I might be, but. And, diverticulitis, those are the ones we're gonna talk about. Now, Crohn's, inflammatory bowel disease, and diverticulitis, they also go into inflammation, but Karen's not talking about them. Just so you don't think you're gonna hear it twice. Okay. Have you guys have any of you had a patient that had intestinal obstruction?
Yes.
Okay. What were they doing about it?
NG tube.
NG. Somebody had
Oh,
surgery?
and a milk molasses enema.
Okay.
Luckily,
I've heard of that.
luckily I got to leave
But
right
do you
before.
think if you had an obstruction? I mean, what is an obstruction?
It's just feces that won't pass.
Well, an obstruction of anything, the highway,
Well, I mean,
anything. Well, how would an enema work? The obstruction's still there.
it's gonna lubricate
Of course, it might depend what is
like
the obstruction,
WD-40.
what's causing it. And that's a lot with this, you have to figure out what's the cause of it.